From TAGTV, welcome to Panorama. I'm your hostess, Ghada Hamadani. The term blindness covers a broad spectrum of visual disability, from when your sight is impaired enough to interfere with daily activities like reading, cooking, or driving, up to total blindness. Today, an estimate of 500,000 Canadians are blind or partially sighted, and over 5.59 million more have an eye diseases that could cause sight loss. Among the 4 leading causes of vision loss, 2 are related to retinal diseases: age-related macular degeneration and diabetic retinopathy. On Skype, from the Eye Institute of Cleveland Clinic, Abu Dhabi, I'd like to welcome my guest, Dr. Ibraheem Al-Ghrably. He's a surgeon with over than 26 years' experience in his field. Al-Ghrably is a fellow of the United Kingdom Royal College of Ophthalmology and member of the American Academy of Ophthalmology and European Society of Retina Specialists. In 2012, Dr. Al-Ghrably received the National Health System Clinical Excellence Award from James Cook University Hospital for excellence in clinical service and contribution in teaching, training, and research. In year 2000, he was awarded the Nottingham University Research Prize. Dr. Al-Ghrably worked as consultant retina specialist and a Royal College tutor, and served as educational and clinical supervisor for specialty trainee doctors. He chaired the Research and Development Division of the Surgery at James Cook University Hospital in Middlesbrough in the United Kingdom. He was the ophthalmology representative of the United Kingdom's North East Local Eye Health Network. Dr. Al-Ghrably is also a member of the advisory board of a number of pharmaceutical companies. During his career, Dr. Ibraheem Al-Ghrably has performed several thousand of ocular surgeries. Without further ado, I would like to welcome my guest, Dr. Ibraheem Al-Ghrably.
Hello, hi, Ghada.
Hi. Dr. Ibraheem, what are the leading causes of blindness?
Okay, the leading cause of blindness is age-related macular degeneration, diabetic retinopathy, we have glaucoma and cataract. Of course, there is many other causes. However, these are the 4 on the top of the list. And the distribution is varied between different countries and different areas of the world. For example, age-related macular degeneration is the main leading cause in the Western countries, and diabetic retinopathy is the main leading cause in the Middle East area, for example.
Is there a reason for why this is happening? You know, it's like it differs from area to area?
Okay. Yeah, more or less. Simply, in the Western, people live longer. The average age for the people in the West live longer, and the age-related macular degeneration, definitely it is the disease of the aging. And in diabetics, for example, there is genetic reasons, and lifestyle in the Middle East is completely different, not that healthy. If I put it this way, they use sugar a lot, the sedentary life, the other thing, genetic predisposition. So this is why it differs from country to country.
Okay. Could you please tell us a little bit about your practice?
I am a veterinary surgeon or a retina specialist, if I put it this way. Simply, I deal with the disease of the retina from the medical and surgical point of view. Okay, so dealing with medical issues like vascular disorders of the retina or diabetic retinopathy, as I mentioned before, and the surgical aspect like retinal detachment and macular holes.
So what is retina and how human eye works, please?
Retina is the inner lining of the eye. If you imagine the eye like a ball, so the lining of the ball is the retina. Retina is the most sensitive part of the eye, or the sensitive layer of the eye, because it contains the receptors which receive the light rays and transfer to the brain to recognize what we see. So when the light rays comes on the surface of the eye, which is the cornea, it is a refractive medium, and then it passes through the lens and then to the retina. And from the retina, all these rays are accumulated from the receptors to be transferred to the brain, as I mentioned before, to recognize what we are seeing.
Okay, could you please tell us a little bit more about the retina diseases?
Retinal disease is a big spectrum of retinal disease, but in general, okay, you can put categories like hereditary retinal disorders where genetic predisposition plays a big role and is transferred through families. You can talk about vascular disorders of the retina where the disease affecting the blood vessels of the retina. You can talk about the surgical problems of the retina like detachment, macular holes, epiretinal membranes. So, as I said, it is a wide variety of disease, and definitely we can go for a very long list if we start talking about it.
I know you mentioned there are there isn't treatments for every single disease. Is there something you can tell us? Which one is treatable? Which one is not? Why?
Okay. Maybe we're lucky nowadays because a big part of the retinal disorders can be treated. The main problem with the retina is the cells of the retina, like the brain cells. When the cells die, it is not regenerating again. It's not like the skin, for example, when we lose cells and the cells regenerate again and again. So, can we treat retina? Yes, we can treat a lot of retinal disorders. For example, some diseases like retinal detachment or macular holes, we can do surgery for these cases and we can repair the retina and put it in place again. And medical disorders of the retina like diabetic retinopathy, we can still now treat a lot of people and maintain the vision for a very long time. However, not all the retinal diseases are treatable. Something like congenital retinal disorders or the hereditary disorders of the retina are not easy to treat. Up till now, we didn't find the way to treat these genetic disorders.
Is there a way to prevent those diseases to occur?
Yes, diabetes, for example, this is the biggest example. Yeah, we can prevent disease, proper control of the blood sugar, and as I say, this is something in your hand. The exercise, physical activity, less sugar in the food, all this kind of just the usual precautions for any diabetic patient can definitely prevent complications and big problems in the retina.
And what are the risk factors of retinal diseases?
Retinal disease can happen without any risk factors. However, there is definitely some risk factors like age, for example. Age, as I told you, just age-related macular degeneration, which is one of the main leading causes of blindness, depending on, usually happen in the old people. Something like diabetes is a big risk factor for problems in the retina, and definitely this is something can be prevented. Smoking can lead to the age-related macular degeneration as well, so this is something.
So what kind of smoking? Is it the regular cigarettes, or we're talking about cannabis?
All types of smoking, all types of smoking can be a risk factor. And other risk factors like other health problems, for example, like hypertension, diabetes, rheumatoid, all these diseases can affect the retina by way or another.
Okay, can you repair a damaged retina?
Sorry, can I repair?
Can you repair a damaged retina?
Yes. Okay. If you mean some disease like retinal detachment, yes, we can return a detached retina back again. Something like macular hole, yes, we can treat something like macular hole. However, if you lose the cells of the retina, this is unrepaired. As long as there is some cells working in the retina, we can do a lot of things in the retina. Only we are handicapped if we lost the cells of the retina.
And how do we lose the cells beside aging?
Diseases. No, aging is what, what I'm saying is, okay, when you are diabetes, you are cutting the blood supply from the retina, for example, and these cells will die because they don't have any feeding because the blood supply is gone, like diabetes, for example. For example, you are cutting the blood supply from any organ of the body, it will die because simply the blood is the nourishment, the oxygen is the food for any organ. And this is how the retina can die. For example, diabetes is a big problem because it simply cut the blood supply to the retina. And in this case, we lose the retinal cells because they are not having enough oxygen to survive. Okay, so this is how we can lose some retinal tissue. Trauma, for example. Degeneration due to age is another thing. It's just we are losing some cells by aging. Something like this. This is how we can lose the retinal cells.
Okay, so what are the symptoms or some of the symptoms, and how do you diagnose retinal diseases?
Okay, retinal disorders, most of them are not painful. So there is no pain coming from the retina. The main visual symptom is visual disturbance, if I put it by this way in a big term. It can be loss of vision, visual acuity, for example, blurred vision, maybe. You can have distortion of the vision in some of them. And you can have flashes and floaters, for example, if there's any traction on the surface of the retina. Okay, so these are the symptoms which people can start to worry that you are losing vision by one or another. And even if you have black curtains, for example, coming on the retina in case of detachment, as I said, usually it is not painful condition, but it is mainly affecting the vision.
Okay, and how retinal tear occur? How the tear occurs?
The tear, okay. Inside the cavity of the retina, there is a gel-like material, transparent material. It's called the vitreous. This gel is attached to the area of the retina or the lining of the eye, which is the retina, at certain points. Sometimes by aging or due to trauma, for example, this gel changed and can contract and pull on the surface of the retina, trying to separate. This pulling on the retina, if it came to a weak area of the retina, it can create a tear. Simply you are pulling on the retina by something, which is the gel, and this can create the tear. So this is how the tear occurs. It is due to traction from the vitreous or the gel which fills the retina over the surface of the retina.
Okay, would the patient know that he has a problem, it's like at this stage, it's like if there is a tear, let's say?
Yes, definitely. When this happens, when this traction happens on the surface of the retina, it causes two big symptoms. Flashes, because it's pulling on the photoreceptors or the light receptors of the retina, and floaters, because this gel, when separates from the retina, it moves freely in the cavity, and it can cause floaters for the patient. So flashes and floaters are definitely the first symptoms of when this tear happens.
We'll take a break, and we'll be back with Dr. Al-Ghrably.
Natural sweetener, Flavorol. 20 flavors to choose from. The perfect substitute for sugar and artificial sweeteners.
Flavorol by Greenish.
Flavorol from Greenish, now available at Rexall pharmacies.
Welcome back. Dr. Ibraheem, so what is the retinal detachment and how it occurs?
Okay. You mentioned the retinal tear before.
Yes.
This is the main leading cause of retinal detachment. Simply, the fluid go through this tear underneath the retina and separate the retina from the wall of the eye. Okay. And when this happens, as I said, the patient starts to feel, okay, he's losing his vision, or black curtains are coming to cover part of his vision. It depends on which area of the retina is separated. But the main cause of the detachment is the tear, retinal tear.
Okay. What do you mean, which area?
Because, it depends. For example, if the tear is closer to the posterior pool or the center of the vision, this is where the patient will feel loss of vision straight away. However, if it occurred in the inferior part of the retina, for example, on the superior part of the retina, on the periphery of the retina, in this case, he will feel just black curtains coming to cover part of his visual field, not the center of the vision. So this is, as I said, how it can present by different symptoms. It depends on where it happens.
Okay. A while ago, you mentioned diabetes and diabetic. So what is the diabetic retinopathy?
Diabetic retinopathy simply is a disease which is affecting the small blood vessels of the retina. these vessels lose the wall, and the blood and the fluid start to leak out of the blood vessels inside the retina. This is where we can see some fluid inside the retinal tissue, and also we can see some bleed inside the retinal tissue, because simply the blood capillaries are not healthy anymore.
Okay, so do you say that all diabetes are in high risk of blindness?
If not all of them, however, any diabetic patient over the long term, by way or another, will have a degree of diabetic retinopathy. Some people will have it quicker than the other. It depends on the level of the control of their blood sugar. Okay, and some people will have later because simply the blood sugar control is better compared to the other. It is not that simple as well, because there is genetic predisposition who will have it.
Okay, we'll go to another point. So what causes macular degeneration, and what it may cause, and what are the symptoms?
That's a big question, because simply no one up to now knows the exact cause of the retinal degeneration and why it happens in some people and it doesn't happen to the others. Not all the old people will have macular degeneration. However, we know it is related to the age. But we don't know why it happens in some people, why it doesn't happen to the other. There is some theories. For example, genetic predisposition, smoking, as I said, running in families. Actually, we don't know exactly why, but genes play a big role in this.
Okay, and what is macular hole, and what may develop it?
Macular hole is a defect in the retinal tissue and the center of the vision. Okay, and when this happens, it leads to distortion of the vision. So all the straight lines appears distorted, and also the visual acuity will come down, because anything affecting the center of the vision will lead to loss of the visual acuity of the patient. However, distortion is a big issue as well. It can happen without any reason, because this is why we call it idiopathic macular hole. However, the main reason at the moment is problems at the vitro-retinal interface. Vitro is the vitreous, as we said before, and the retina, the cells of the retina. As we said, the vitreous is attached to the retina at certain points. Pulling of this vitreous on the center of the vision can create.
Okay, you just mentioned light distortion. So it's like I'm going to ask you a question related to LASIK operations. Usually after the LASIK, the patient, start experience light distortion. So does that mean that they have a disease? They are developing some symptoms of what we're talking about, or what?
Okay, LASIK is completely different issue, because LASIK happens on the corneal tissue, not in the retina. And the changes on the refractive media of the eye definitely can lead to some distortion for a while, until the whole tissue returns back to normal again. Because with the LASIK, we are removing layers of the cornea just to adjust the cornea to compensate any refractive error inside the eye. But as I said, it's a temporary after the LASIK. However, after a few days, everything back to normal in most of the patients.
Okay, Dr. Ibraheem, when and what makes you decide to go with surgery?
The disease itself, okay, it depends on the type of the retinal disease. So simply, detachment is not repairable except with surgery. Okay, so this is a straightforward decision that the patient needs surgery. Macular hole is, again, it's not repairable with any medications or with any drops. It has to be surgery. So it is mainly which disease we are dealing with. Some diseases are only for surgery.
Does laser have a role here in this, in this field?
Without doubt, yes. Laser is one of the toys that we use in our retinal surgery, if I put it this way. Okay, we use laser for diabetic patients, for example. Okay, simply, if you had a little bit of blood supply in the retina, which is not covering all your retina, where do you want this blood supply to be directed? You need it definitely to be directed to the center. And for this to happen, you need to kill the periphery. Laser is used to just destroy the periphery to keep the center alive. Laser can be used to repair the tears in the retina. Okay, so when we say retinal tear, which can cause detachment, how can we repair or seal this tear? We use laser for something like that. Okay, so laser always with the retina is a nice story. Can use it for diabetic
Does it
patients.
replace surgery at some point, or no? We have
No,
to
it is.
different.
It's part of the surgery. Without that, for example, if it's a detachment, yes, it's part of the surgery to seal the tear. Okay, so we use laser for something like this. However, in diabetic patients, it can be, if it's done in the proper time and the right time, alternative to surgery, if I put it this way, because it can control the disease earlier, and in this case, we don't need to go for surgery.
So how reliable are the surgeries?
Nowadays, much better than before with the advance in instrumentation and the machines and the technology. Definitely, surgery can give better outcome compared to previous 20, 30 years, for example. Okay, so we have a great chance for retinal detachment repaired. 80% of retinal detachment by one surgery can be repaired, for example. More than 90% of macular hole surgeries can be successful from one surgery, for example. So it is reliable. If I put it this way.
Sorry.
For
No, go ahead.
No, I'm saying it is reliable for certain diseases without that.
Okay. So before you operate, do you lay out the risk and benefits to your patients beforehand?
Yes, without doubt. It is part of our consent. Every patient is consented for surgery, and part of this consent, we call it informed consent. Informed means we're telling them about the risk and benefits, and it has to be written in the consent as well. Okay.
So why you decided to become an eye surgeon?
Oh, well, okay. I always consider ophthalmology as one of the top specialties in medicine. Ophthalmology is a unique branch in medicine, if I put it this way. It has three big categories. The medical aspect of it, what I mean is a lot of systemic disease affecting the retina, like diabetes, hypertension, rheumatoid, connective tissue disorder, something like this. Surgical aspect, where you can use the delicate, nice microscopes to do a very fine surgery. And usually they call us the clean eye surgeons because we don't have a lot of blood or field of blood in our surgeries. This is why it is a challenging surgery and it's nice surgery. And it's a unique thing for ophthalmology, which is optics. So we're dealing with physics, refractive media, and the glasses, contact lens, those kind of things. So ophthalmology is beautiful subspecialty of medicine and gives you satisfaction, whatever your passion is. If your passion was medicine, then it will be there. If your passion was surgery, it will be there. If your passion was physics, it will be there.
Okay, do you have any work-related regrets?
No, at all. Maybe I was lucky in my life from different points. First of all, I had the chance to go to medical school, which I like. Second, I managed to have ophthalmology as subspecialty, which is definitely my passion when I was in medical school. And I was lucky to be trained in proper centers in Egypt and England as well, and mainly in England, without doubt. And wherever I work, I had the chance to work with beautiful colleagues and beautiful patients and beautiful atmosphere. So there is no regret regarding my career by any means.
Okay, Dr. Ibraheem, can you tell us an interesting fun fact about yourself, please?
Oh, fun fact. Okay. Actually, there is no big fun facts. Okay, apart from I can stop the clinic in the middle of the clinic, okay, in a busy clinic, just to have 5 minutes with my nurse and my hug and my assistants, listening to a song. Okay. We can sing even together in the middle of the clinic, just to give ourselves some sort of relief. I always sing when I'm in the OR or when I'm in the operating room. I always sing, although I don't have a good voice, by the way, just to tell you.
I was about to ask you, can you sing for us?
No way. Okay. No, this is in the operating room. If you manage to find an operating room for me, I can sit there and just sing nicely. There is no problem.
We are in operating room too.
Okay, that's right. Okay. No, actually, this is just one of the fun things. I like always to have this fun atmosphere. I always sing with my colleagues. Okay. I don't have a good voice, but I just like always to do it.
You can try. Who knows?
Difficult. Okay,
Okay.
no.
Do you have any hobbies? What do you do like at your free time?
Okay, of course, when you ask any doctor, okay, what you do in your in time, he will say not much left after being from 7 o'clock in the morning till 6 o'clock in the evening, rather than just to rest in the front of the TV. Fine. Okay, I like to sit in the TV just watching something, and I like walking. I like reading a lot. Like I used to be a bookworm. That's what my colleagues used to call me. I like listening to the music, without doubt. I gym from time to time if I had the time for the gym.
Okay.
That's
If you could go back in time, what would
Yeah.
you change or choose differently?
Nothing, honestly. I was satisfied with what I had in my life. I was satisfied with what I achieved. As I told you earlier, I didn't regret anything from what I have. So there is nothing different to do. Just to stay as I am. That's all.
Okay. Is there anything you'd like to say to the audience today?
It was a pleasure to be with you, Yada, and with your audience as well. And really, this is my first, okay, if I say TV program in a nice place like Canada. And it was pleasure. And I'm happy to be with you and with your audience. All what I want to say to them, okay, please live healthy, eat healthy, stop smoking, because that is definitely affecting, especially in the old age. And take care of your eyes. Any problems with eyes, don't wait long. Just go for a doctor.
I know before we start recording, you mentioned that you'd like to mention something about UK and other areas that you lived in. So I'll give you a chance to say one more thing.
What I'm saying is, as I told you, I enjoyed every place where I worked, but definitely the practice in UK is slightly different from the practice in the Middle East. As I said, in UK, people awareness definitely is much higher with their health problems. They have more healthy life style, if I put it this way. A lot of them play sports. They take care more about their food, the type of food they're eating, the calories, all this kind of thing. And this is make the complications of certain diseases much less, like diabetes, for example. In the Middle East, still, definitely, we need to raise the awareness about all the problems of diabetes. We need more healthy lifestyle. We need more healthy food. We need just as I said, to even take the expectation. The expectation is completely different from there. It's easy to explain to the people in the West. This is the disease. This is the treatment, and this is the risk and benefits. They can get this easily. However, here the expectation is always higher than what we have in our hands. Sometimes we have our limitation, and just this is put you in a situation where you have to explain and explain and explain. But I think it is the awareness is rising much more now than before, and definitely by time I'm hoping the whole world is like a small village nowadays, and people started to learn how to live better, how to eat better, how to behave even better. So hopefully by time things will be much better.
Dr. Ibraheem, it was a great pleasure having you today with us. Thank you very much.
Thank you very much. The pleasure is all mine, and thank you for the invitation as well. Thank you.
Thank you. Up until next time, have a good night.